Thank you, everyone, so much for joining me today. Just to give you a brief overview of what we're about to discuss, we are going to take a look at the PQRS program, understand what that program entails, and give you a little bit of background about what it is. We'll then review the incentive and penalty schedule for the physician quality reporting system as it relates to both the 2012 reporting period as well as 2013. We'll then proceed to a tour of the PQRIWizard online tool, and we'll close today's webinar with a question and answer session. I just want to remind everyone today that the webinar is being recorded and an archived version of the video and the slides will be made available. Today's presentation slides will also be made available to you. And again, if at any time during today's presentation you'd like to ask questions, you can do so by using the questions or chat feature on the webinar menu. And at the end of today's webinar, we'll address those questions as time permits. So to give you a brief view about PQRS, it stands for the Physician Quality Reporting System. In past program years, it was called the Physician Quality Reporting Initiative. So if you hear PQRS or PQRI, just know that they're almost used interchangeably, but they refer to the same program. It was developed by CMS in 2007 as a voluntary pay-for-reporting program. So the PQRS program, the Meaningful Use program, and the e-prescribing program are all separate programs. So it's important to understand that as we proceed through today's webinar. I get a lot of questions about, if I'm doing Meaningful Use, do I also need to do PQRS? And the answer is yes, they are separate programs, and you should be reporting under both. So in 2012, those who participate in PQRS are eligible to receive a 0.5% financial incentive payment on their allowed Medicare charges for services furnished during 2012. Just as a side note, the PQRIWizard is accepting 2012 PQRS reports through the middle of March of 2013. So if you haven't done your 2012 PQRS report and you would like to, you still have time to do so. And in the latter part of today's presentation, we'll explore the PQRIWizard. To give you an idea of everyone who's eligible for PQRS, I've listed all of those eligible professionals on the screen in front of you. So it's not just for physicians, it's for any billing provider. And again, as we move towards a penalty-based program for non-participation in 2013, even those providers who are on this list, if they're not reporting PQRS, they'll suffer that penalty as well. So there's a couple different ways that you can work PQRS measures. One of them is through the claims process, and I'm sure many of you may be familiar with that. This process entails appending your Medicare claim with specific CPT2 codes or G codes that have to be submitted at the time your claim goes to Medicare. So that's one way of reporting PQRS. There's also the EHR submission method. So many EHRs out there are qualified to report PQRS, and that reporting is done automatically through the EHR. So if you're using an electronic health record, you may want to check with your vendor to inquire about whether or not their product can do your PQRS submission for you. Finally, you can also report through registry. This type of reporting is separate from the other two that you just explored. It's done independent of your claim submission process, but it allows you to report retroactive visits that you may have seen earlier in the 2012 year. As we speak to the 2013 reporting year, you'll also be able to do retrospective reporting, but only for that 2013 program. So some of you may be wondering why it's beneficial to use a registry like the PQRIWizard. And what I'm showing on the screen right now are some statistics from the 2010 Physician Quality Reporting System. This is the latest data that is available on the program. So it is from 2010. However, the results of this study are overwhelmingly in favor of registry-based reporting, in that, between 87 to 94% of providers were found to be eligible for their incentive payment through the use of registry-based reporting, as opposed to 53 to 61% of those who reported through claims. So, if you're wondering why registry reporting may be beneficial to you, it's simply because the data indicates that it is more successful in terms of helping you achieve an incentive payment. And again, as we move towards a penalty-based program in 2013, it should help you to avoid any penalties as well. So let's take a look. I've been talking about the incentives and the penalties, so let's take a look at what that schedule actually looks like and what it means to you. So again, in 2012, for that program year for PQRS, providers who participate can receive an incentive payment equal to 0.5% of their total allowed charges for Medicare fee schedule covered services. This incentive is also available for the 2013 and 2014 PQRS programs. Providers who do not successfully report PQRS measures in 2013 will automatically get a 1.5% penalty that will be realized in your 2015 Medicare reimbursement. That penalty will actually increase to 2% for each year thereafter. So again, when we talk about registry-based reporting being successful in helping you achieve incentive payments, it's also that much more successful in helping you avoid any penalties as well, because you see the operative word in that second bulleted statement there is to successfully report PQRS. So it's not just that you attempted to do it, it's that you successfully did it and met the requirements that CMS sets forth for PQRS reporting. So let me give you a little bit of information about CE City and the PQRIWizard. We have been a CMS certified registry since the inception of registry-based reporting for the PQRS program in 2008. Since that time, we've submitted PQRS reports for thousands of healthcare providers, and we actually have a 99% success rate in helping providers achieve their incentive payment. If you're looking for us in the list of CMS qualified registries, our product name is PQRIWizard, and we're also listed under CE City. As I mentioned before, if you want to report for 2012 PQRS, you can do so through March 14th of 2013. So you still have a couple months to come in and do your 2012 reporting. And because with registry-based reporting, you can report patients retrospectively, it's time to go in and enter in your 2012 data. So let's take a look at the measure group for plastic surgeons that the ASPS has identified as one that you may want to report for 2012 or 2013 PQRS. So the measures in the measure group are around perioperative care. They're measures 21 through 23, and the titles of each of those measures are presented for you on the screen. What's nice about reporting a measure group is that for the 2012 program, it only requires a 30-patient sample. All 30 patients need to be Medicare patients. In 2013, when we talk about that type of reporting, the only 20 patients are required, the majority of which must be Medicare. So again, PQRIWizard is presently doing reporting for 2012 PQRS, and then we will reopen for 2013 PQRS reporting in the spring. So moving on from there, there's also several individual measures that you may want to report. So if you feel that the measure group isn't a viable option for you, then perhaps, review some of these individual measures for the 2012 or 2013 reporting period. One of the things that's different about reporting individual measures as opposed to measure groups is that individual measure reporting calls for a minimum of 3 measures. So of this list of measures that you see on the screen, you would select 3 that you want to report, and then you would report them for 80% of the Medicare patients that are eligible for each measure. And you would do that for the entire 2012 or 2013 reporting period, depending on which PQRS year you're intending to report. A side note here is that Measure 124, it is available if you're reporting for 2012 PQRS. However, that measure was retired for the 2013 PQRS program, as was measure number 186. So if you go into the PQRIWizard today, you will see all of the 2012 measures in there that all comply with the 2012 measure specifications. The 2013 measures will come in the spring when we relaunch for that program year. And again, you'll see another note at the bottom of the screen just indicating that the individual measure specifications for some of the perioperative measures are different than the measures group. So it's in fact the manual if you're wanting to know what the differences are between those. Or you can go into the PQRIWizard and take a look at the information that's available there as well. So now let's take a quick moment and we will go through the PQRIWizard to give you a brief tour of what this tool looks like and how you would use it. So the URL where you would go to access this is ASPS PQRIWizardSM. You can see that the site does carry the ASPS logo on the corner. If at any time when you're using this system, if you'd like to contact our support team, we have a full staff of dedicated individuals who are very knowledgeable in PQRS. You can contact them by using that support link in the upper right-hand corner of the site. They are available Monday through Friday from 9 to 6 p.m. Eastern to take your questions. So I wanted to point that out for you today. Additionally, there is a frequently asked questions document that's linked from this website. So some of your questions may already be answered. So please do take a look at that document if you have some questions. And finally, we also link out to some PQRS information from CMS through this site. And the final link here is the list of eligible professionals that I reviewed in an earlier slide. So if you wanted to get a quick reference to that, it's also posted on the site. So we talked about this before, that the 2012 PQRS reporting is still an option for you. You just simply register with the PQRI Wizard and submit by March 14th of 2013 to be eligible for the 2012 program. If you want to do 2013 PQRS reporting, we'll open that up in the spring of 2013. And don't worry that you're not starting it until the spring. You will be able to go back and report on encounters that took place earlier in the year. If you are ready to begin reporting the PQRI Wizard, you'll visit this site and you'll click on that Start Now button. And what this will do is it will actually launch you into a measure selection guide. Now, I do want to point out that the fee is $299, and that's per provider per reporting year. So if you have one provider who wants to report for 2012, it's a $299 fee. If you have another provider, they could be from the same practice or another, then it would be an additional $299. Once you click on that Start Now button, it will bring up this measure selection guide. And what this will do is give you some information about the different reporting options that are available to you. As you recall, I discussed the measure group reporting requirement. For 2012, it's 30 Medicare patients. For 2013 reporting, which will open in the spring, it is just 20 patients, the majority of which need to be Medicare. So you can choose that option. Or the second option on the screen is for individual measure reporting. And that option, again, is to select 3 measures and report them for 80% of the Medicare patients that are eligible for those measures. So when you click on an option, I'm going to choose the option for measure groups. It will display more information about that group, including the measures that are in the group. One of the things that's important to pay attention to at this stage are these data collection requirements that are listed on the screen. So this system will tell you that you need to do 30 Medicare patients. It will tell you which Medicare patients are eligible. It's Medicare fee-for-service, any railroad retirement board beneficiaries, and any Medicare secondary payer beneficiaries. Again, pay specific attention to the fact that Medicare Advantage beneficiaries are not eligible for PQRS reporting. It will also give you a list of the procedure codes that are valid for this measure group, and this is how you're going to identify the patients on which you should be reporting. So if you expand that plus sign, it will open up and show you all of the procedure codes that are eligible for this measure group. What you see before you are all the procedure codes that are eligible for 2012 reporting. When we relaunch for 2013, there's actually a lot more codes that will be eligible, so that may prove advantageous to you or to your practice in your decision to report this group or not. So from there, now we're going to take a look at the individual measures. So if you had selected the other option on that one screen to report on individual measures, then we would present you with this screen that shows you all of the individual measures that are available under this grouping. Again, it's important to review the measures that are in this measure set. And just like we did for the measure groups where we showed you all the codes that were eligible, we do the same thing for the individual measures, and we show you what patient encounter codes are eligible for specific measures or procedure codes or whatever the measure calls for to help you identify which patients are eligible for that measure. When you're ready to move forward with a measure group or the individual measures, you just click on that register button. It will take you through a brief registration process, and then it will take you through payment, and then you'll be presented with the start screen for the measures that you are going to report. So first we'll take a look at measure group reporting, and then we'll go and take a look at what the individual measure reporting looks like, because the processes are similar but just slightly different. So with your group reporting, the first thing that you're going to do is you're going to enter in the NPI and the tax ID number for the provider. I want to stress the importance of these two numbers. If you make an error in either one of these numbers, you won't be eligible for the incentive payment, and it could influence your penalty standing as well. So it's important that you register with your individual NPI number and with the tax ID number that you're using for your Medicare billing. What we'll do next is we'll be able to validate your NPI number with the National Plan and Provider Enumeration System, but the tax ID number is something that you are going to have to accurately report. And please also note that if you make an error in either one of these numbers, CMS will not allow you to change that information. So once the data gets submitted to CMS, and that happens in March of every year. So, for example, the 2012 PQRS reports will all go to CMS by the end of March in 2013. If you come to us after that point and you say, I made an error in my TIN or my NPI, CMS will not permit us to modify the submission. So once it goes to CMS, we can't help you. But if you catch it before we submit it to CMS, so before March, then we will be able to make a change in our system because it's not an instantaneous submission to CMS. We'll ask that you then verify this information on this screen is correct, and then you can move forward. The next thing that you'll have to do is to complete a brief online attestation that simply states that you give our registry permission to submit the data to CMS on your behalf, that you're authorized to provide that information to our registry, and then all the data that's provided is true and accurate. And you just click the box on the screen to agree to that. From there, you'll be able to enter in all of your patient data for the measure group. So what you see before you is the perioperative care measure group. To enter in a patient, you click on that green Add Patient button, and it will bring up an online web form. The next thing that you can do is you can choose to, so that's that online form that I just mentioned. The next thing that you could do is if you're doing individual measure reporting, you will go through the same three steps to set up your account, the entering the NPI and the TIN, the validation of that information, and the attestation. But then you'll actually select the three measures, and you can do more if you want. You'll select the three measures from that list, and then we'll ask that you confirm that information. But what's unique is that when you're on this select measure step within the program itself, you can click on the title of the measure to get more information about the numerator and the denominator for that measure. So a lot of people want to know, well, what exactly are they looking for in this measure? So you can see from this description that Measure 112 for screening mammography is looking at women aged 40 through 69 years old who had a mammogram to screen for breast cancer within 24 months. The denominator would be all of your female Medicare patients aged 40 through 69, and the numerator would be those who had a mammogram at least once within the past 24 months. So once you've selected your measures, you'll then be presented with this screen. And it looks very similar to the measure group screen, but the one thing that's different is that we allow you to upload information into the PQRWizard for individual measure reporting, whereas with measure groups, they all have to be entered online through that web form. So if you wanted to upload your information, you can do so. So what you see before you is actually just a screenshot of the online data entry form. So if you wanted to manually enter in patients, you would see something similar to this that would allow you to enter in that patient information. You can see that we ask for the encounter code for that patient, and then we get into the specific G codes or CPT2 codes that you would report to us and indicate what occurred at that patient visit. If you wanted to upload the information, we do provide you with templates and definition files to help you map that information. You would either extract that information or compile it directly within that template and then return to the PQRWizard to upload the information. One of the other things that's important to realize, when you're doing PQRS reporting, you have to report measures that have a performance rate greater than 0% for each measure on which you're reporting, even if you're doing it as part of a measure group. So one of the things that the PQRWizard will do is we'll actually prevent you from submitting a report that is not compliant with that rule. The reason why is that if you submit a report with a 0% performance rate for any one measure, basically meaning that there's no patients that satisfy the numerator, then CMS will say that you're not eligible for the incentive payment. So the PQRWizard has that built into the system that we won't even let you get to the next step in the PQRWizard until all of your performance rates are greater than 0% for every measure that you've selected to report. From there, if you're doing individual measure reporting, we'll ask that you verify that you reported on 80% of your Medicare patients. If you're reporting on a measure group, you won't see this screen because you'll just have to reach a 30-patient sample and tell when you've done that. So the next thing, basically, that the system will calculate your performance scores, and this happens in real time. It just takes a few moments to calculate that information. We'll tell you what measures you reported on, what the numerator and denominator values are, as well as what your performance score is for each measure. From there, if you're satisfied with this information, you can click the Continue button. You will be at the final step in the submission process, and this screen is a nice indication of exactly what will be submitted to CMS. So it will show, again, what the NPI and the tax ID number were for your report, the name under which that report was submitted, which is tied to that NPI number. We'll redisplay all the measures that you just reported on, as well as your performance metrics. And this is a nice screen to print and keep a copy of for your records, because this is the information that we're going to CMS on your behalf for your PQRS report. And once you reach this step and you've reached this confirmation screen, there's nothing more that you need to do with your PQRS report. As part of the service, PQRIWizard will submit your information to CMS on your behalf, so there's nothing more that you need to do at this time. So at this time, I'd like to invite you to pose any questions that you may have using that chat or questions feature on the webinar menu, and we'll be able to address your questions. Before today's webinar, we did receive some questions through email or through the registration process, so I'm going to review that information right now. And the first question was, how do we report on these measures for whatever reason, if they're not applicable for our practice, or we just don't have any patients that fall within those denominators? What do we do? How do we report that information? So there's three ways that a physician can meet the criteria for reporting for the 2015 PQRS payment adjustment. So you can meet the criteria for reporting the 2013 PQRS incentive, and that's just basically reporting PQRS successfully. That will help you avoid any penalties. You can report on one measure or a measure group using claims registry or EHR-based reporting mechanisms, or you can elect to be analyzed under what's called the administrative claims-based reporting mechanism. You won't get an incentive through that method, but you also won't get any penalties. So if you're looking for a way to get a waiver, you may want to choose one of those three aforementioned methods. If a physician wishes to do the administrative claims-based reporting mechanism to avoid the 2015 payment adjustment, the physician must affirmatively elect to be analyzed under this reporting mechanism. So moving on from there, the next question that we received was, if I do PQRS, do I still need to participate in TOPS? And the answer to that question is that TOPS is a separate ASPS program available to use for free to all active members of the society, and TOPS is completely independent from CMS and the PQRS program. So note that there's no connection between PQRS and TOPS. So again, if you have any questions, please do submit them through the webinar menu, and I'm going to start fielding the questions now. So thank you so much. The first question is, if we did not report anything in 2012, can we get the 0.5% incentive if we report in 2013? So the answer to that question is, if you report in 2013, then you would be eligible for the 0.5% incentive payment. And if you successfully report, you would also be exempt from that 1.5% penalty that will come into effect in 2015. So the bottom line here is that your participant PQRS in 2012 is independent of what you do in 2013. And while there's still plenty of time to do your 2012 PQRS reporting through the PQRIWizard, you can do that through March 14th of 2013. Your 2012 participation will not affect your 2013 participation. The next question is, if you're reporting for 2012, does the date of service have to be in 2012? The answer is yes. So for whatever reporting year you're reporting, so if you're doing 2012, then all of the on which you report have to be from that 2012 year. The next question is, for 2013 PQRS, do you report on 20 patients or do you report on an 80% sample? The answer is it depends. It depends if you're doing a measure group, like the perioperative care measure group. The requirement for 2013 PQRS is to report on 20 patients, the majority of which need to be Medicare. So you have to have at least 11 or more that are Medicare. The other 9 patients can be from any payer. If you are reporting on individual measures, then you select 3 measures and report them for 80% of your Medicare patients that are eligible for those 3 measures. The next question is a good question. It's asking, if I started to report through claims, but I want to change to registry, how does that work? The answer is, if you want to switch from claims-based reporting to registry-based reporting, you absolutely can. But if you want to report through registry, and you have done it previously through claims for the year, you have to report all of your eligible patients through one mechanism. So you cannot take half of the year from your claims and half of the year through registry and combine the two for one full report to CMS. CMS will not analyze it that way. CMS requires that you submit and meet the requirements fully under one method. So you'd have to meet the requirements under registry-based reporting in order to be eligible for participation. So you can't combine the claims and the registry, but you can absolutely switch at any time to registry-based reporting. The next question is, what if I don't have 30 Medicare patients? So if you don't have 30 Medicare patients, and I'm assuming this is referring to the 2012 reporting program, if you don't have 30 Medicare patients, then you could either elect to do the 80% sample for the perioperative care measure group, which requires at least 15 patients, but you still have to do 80% of the whole. So if you have, say, 20 Medicare patients, you'd be required to report on at least 16 of them for that measure group. Or if you want to report on individual measures, you could, of course, report on 3 measures for 80% of the patients that are eligible there. There's no patient minimum for individual measure reporting. And again, that is for 2012 PQRS reporting. The next question is, do you need to do this report every year, and how long do you have to do this reporting? So PQRS has been in existence since 2008. If you want to get the incentive payment for 2012, then you can participate. If you want to participate in 2013, you can be eligible for a 0.5% incentive payment, and you will also avoid the 1.5% penalty. And this program is going to remain in place for future years as well. So the 1.5% penalty in 2015 actually increases to 2% for each year thereafter. So the next question is, do you have to do the individual reporting if the bulk of your CPT codes don't fall within the allowed codes for the group reporting? And it sounds like there might be 2 different questions there. So if you want to do individual measure reporting, then you would report on your patients that have that combination of ICD-9 and CPT code that qualify the patient for the measure, and you would report on 80% of them. So if you had 10 patients that qualified for the measure based on their denominator eligibility, which again is that combination of ICD-9 and CPT code, so you had 10 patients to meet the 80% requirement, you'd report on 8 of them. If you're doing measure group reporting, the requirement for 2012 is 30 patients. If you don't have 30, you could report the 80% method, which requires at least 15. And if you wanted to do 2013, again, it's just 20 patients. So hopefully that answers that question. The next question is about how to avoid the 2015 penalty. And the question is, according to CMS, if you want to just avoid the 2015 penalty, all you have to do is report one patient under one measure. Is that true? So there is a way to avoid the 2015 penalty. You will not be eligible for any incentive payments if you do this approach, but CMS has said that you just report one measure for PQRS, and it will help you avoid the penalty in 2015. So the next question is asking about, their center submits core measures for perioperative antibiotics. Does this count for the two providers, or is this a separate program? Assuming that this question is pertaining to the meaningful use core measure, the meaningful use program and the PQRS program are separate. So if you're submitting under meaningful use, it does not mean that you're submitting for PQRS. So you would need to report those measures separately under PQRS. The next question is the 0.5% on the PQRS claims or all Medicare claims for the year? The answer to that question is the 0.5% is based on all of your allowed Medicare billing for the year, not just those that were coded for PQRS. The next question is, if your practice is set up as a group with Medicare, but you only have one provider in that group, can you still do individual reporting, or do you have to do the group reporting? So the answer there is a little bit complicated, but basically, if your practice is set up as a group practice, you want to check your claim to see if at the rendering level, if that NPI is the physician's individual NPI number. If so, then you can continue to report as an individual provider doing measure group reporting or individual measure reporting. If you are only billing at the group level, meaning there's no individual rendering NPI on your claims, then number one, I suggest contacting CMS to confirm that you have to do the group practice reporting option. But number two, it's likely that you should take a look at those requirements. It seems as though you may have to do GPRO if you are only billing as a group. But we'll follow up with you after the call just to help you get the answer that you need, because it's a little bit of a different situation there. The next question is, if I'm reporting through registry, do I have to submit the G codes on my claims? And the answer is no. If you want to report through a registry, you don't have to tell CMS that you're going to report as a registry. And again, this is for individual provider submissions. If you're participating in that group practice reporting option, it's a different submission process. But if you are going to participate in a registry, then all you need to do is submit your data to the registry, and CMS will take your submission of data to that registry as an indication that you're going to participate through that reporting mechanism. So you don't have to do any G codes on your claims if you're going to use a registry. The next question is more of a, how do I do this kind of question? And it says, do you enter patients throughout the year intermittently, or do you wait until the end of the year? I always encourage people to enter the patients throughout the year rather than waiting until the end. But it's up to you, really. If it's easier for you to pull all your patient charts at the end of the year and report them for PQRS, the registry will permit you to do that. But if you would like to enter in the patients as you see them or intermittently, as this question was stated, then you can do that as well through the registry. That's up to you. The next question is about registering as a group rather than as individual physicians. There's some information posted by CMS about how to participate in that group practice reporting option. There is a self-nomination period involved in that, and what we'll do is we'll follow up with you after the call to post that information, and ASPS can also follow up to give you the link to where that information is from CMS. The deadline to report 2012 to be eligible for the incentive, and the PQRIWizard deadline is March 14th of 2013. So as long as you register and report and complete all of your data entry by March 14th, then you'll be eligible for that 2012 incentive. And you can go to ASPS.PQRIWizard.com to register and get started today. . Just reading through the next couple of questions here. If your EHR submits PQRS to you, do you have to use the registry? No. If your EHR is submitting your PQRS data for you, then you do not need to also use the registry. CMS only requires that you participate successfully through one method of PQRS submission. So that could be EHR, or it could be registry, or it could be claims. You just have to pick one method and report it. But I do suggest confirming with your EHR vendor that you are enrolled in an EHR that does do the PQRS reporting, or that the version that you have implemented, the EHR version that you have implemented, is doing that reporting for you. The next question is, what if patients or physicians share the same patient? Can they both submit the same patient if they are seen on different occasions, for example, a plastic surgeon and a dermatologist? That answer is yes. As long as you build Medicare for an encounter for that patient, then you can report them for PQRS. And if another provider in the practice sees the same patient on a different encounter date and bills Medicare for one of those services, then they can also report that patient for PQRS. The next question is there a no-charge registry that we can use, or do we have to go through a submitter? I guess you could say that no-charge option is likely the claims-based submission method. The registry-based submission often does carry a fee. The PQRIWizard fee is pretty low at $299 per provider per year. The next question is, how much time does it take to add in patients, and how much information is required? So very different from traditional registries. The PQRIWizard is only collecting what we need for PQRS measures. So we're only looking at the numerator and the denominator information that we need to calculate that measure for submission to CMS. So it's not going to be a huge, lengthy data entry process. Most people tell me it takes them, between 3 and 5 minutes per patient to enter. And I received some feedback from a physician, several physicians actually, who said that it took them about 1 to 2 hours to complete their entire report. But again, that will vary based on your practice and on your patient volume and the measures and the number of measures on which you're reporting. The next question, and I believe we covered this a little bit earlier, but I think it's good to reiterate, is what do you do if you are trying to avoid the penalty and not obtain the incentive? So what you do is you can report on one measure or one measure group, and that will help you to avoid the penalty. You can also elect to report or participate in what's called the administrative claims option, and we can provide you with more information on that after the webinar. The next question is about when the 2013 PQRIWizard will be available. We'll launch that in the spring. So we will close out 2012 submissions by the end of March. And again, the submission deadline for all the data is March 14th of 2013. By the end of March, we will have given CMS all of our registry submissions, and then we'll relaunch the 2013 PQRIWizard sometime in April or May. Is it better to submit a measure group or individual measures? That is something that's up to you to decide. You can just take a look at what's required, and it's truly up to you as to which measures you want to report. The next question is, do the patients need to be consecutive patients, or can you pick whatever patients you want to report? They don't have to be consecutive patient visits, but they do have to be patients that are eligible for the measures on which you're going to report. So. And they have to be Medicare patients. So in past program years, I think maybe it was 2009 or maybe even earlier, the patients used to have to be consecutive, but they do not need to be consecutive anymore. The final question that we have here is, if you're submitting measures under meaningful use, why can't you also use them for PQRS? And the reason is that there are similar measures under meaningful use in PQRS. However, meaningful use and PQRS remain separate programs. And so if you want to qualify under meaningful use, you have to meet the requirements under that program. And then if you also want to do PQRS, you have to meet the requirements under that secondary program. So CMS doesn't analyze, unfortunately, they don't analyze your submissions under one program and apply it to another. You'll have to report the information twice. Another question is a good question. Which agency at CMS will be double-checking the information that we're submitting? CMS does analyze your PQRS reports to ensure that you have reported on the correct number of Medicare beneficiaries that were billed through your NPI and tax ID number. This gets back to the importance of reporting under the correct NPI and tax ID, because if you make an error in either one of those numbers, CMS will basically say that you didn't bill any beneficiaries because you have a wrong NPI and TIN combination. Furthermore, they do spot check the data that you're entering against your claims data that you've submitted to make sure that you're reporting on the appropriate number of patients. The next question is about, where do I find the G codes? Where is that information listed? The G codes are listed in the measure specification manual, and I'm actually just going to jump back a couple slides to show you where that information is. Just bear with me one moment while I do that. We have the link in some earlier slides. So here we are. So if you are looking for the measure group code, take a look at that link on the bottom of the screen, and that's where you can get the G codes or the CPT2 codes for each of the measures. So you can take a look at that information on the CMS website. The second place you can go for it is to take a look at the PQRIWizard. And on that screen, we do provide a link to the measure specifications that you see from CMS. So under that final box that says PQRS information from CMS, that will give you a link to the measure specifications that will have the G codes in them. The final question we have here is, if we purchase PQRIWizard, is there someone available to go through all of this information with us and help us get set up, help us educate the doctors on how to decide which patients to report, et cetera? Absolutely. Just contact us using that support link in the upper right corner of the screen, and a member of our team will be able to help address any questions that you may have. If you want to set up a call with the physicians in your practice to go through everything and answer questions all at one time, we can certainly do that for you. And again, we'll also make a recorded version of this webinar available to you so that you'll have that resource as well. The next question is, are there more measure options through one reporting method than another? When you say reporting method, I'm going to assume you're referring to the difference between claims-based reporting or registry-based reporting, and the answer is yes. There are some measures out there that are registry only. So some measures or measure groups can only be reported through a registry, and they are not permitted for claims-based reporting. So you'll have to take a look at the information on the measure specs to see which ones you can report. With registry, we try to support as many measures as we possibly can. So we do make available measure groups as well as individual measures. So are there any further questions at this point? I just want to give everyone a moment to kind of digest everything and see if there's any additional questions from the audience. Okay, if there are no further questions, I just want to point out that, again, if you have any questions or you want to speak with our support staff, the best way to get a hold of us is using the support link on the ASPS website. There are updates from ASPS on the physician quality reporting system available through this link that you see before you. If you have any questions that you would like to direct to the ASPS, you can always email research@plasticsurgery.org, and they'll be able to help answer your questions. And finally, if you want to visit the ASPS PQRIWizard, hopefully to do your 2012 reporting and then visit us again in the spring, just visit asps.pqriwizard.com. Thank you, everyone, so much for your time today. Again, we will make a recorded version of this webinar available to you, as well as provide a copy of the slides. Thank you so much for attending.